Hey everybody, good afternoon. This is Dr. Dunn again from Johnson City. And today we're going to talk to you about a couple of spinal issues, whether it's neck or low back. And with most cases in our office, we come from the approach of good, better, and best. And then we also come from the approach of physical medicine and regenerative medicine. So for instance, good is going to be physical medicine. Best is going to be regenerative medicine. In the middle is going to be better, which is going to be physical medicine and regenerative medicine. It's going to be both. Because PRP is going to be more of a physical medicine product, and the palagen and the amniocyte is going to be more of a regenerative medicine. Under good, we can tape using kinesiotape. We can use modalities such as an ultrasound or an interferential electrical therapy. We can do adjustments to the joint to restore normal joint function. We can do trigger point injections where we're looking at reducing the inflammation and the pain. Thereby we can do the treatments better. We can do cross-friction massage, which helps in many of these different cases, and then rehabilitation. This is our basic program. If we're going to do anything, it's going to include this. Now, this is when we get into some different stuff. When we look at better, what's a little better? If we add PRP, platelet-rich plasma, if we add that to our treatment, patients will respond better. We're using your own blood. That's why it's a physical medicine piece. We also have a palagen injection, and that is an amniotic tissue. So it's a human tissue product, as well as Amniocyte Plus is a human tissue product. And again, when we use these products, people get better, they respond better, they heal faster, and they regenerate tissue. Palagen is something that is new that some insurances are starting to pay for. Amniocyte Plus is still not there. And then the best, MSC, is mesenchymal stem cells. It's from the umbilical cord of a healthy live newborn. When you add these three pieces together, that's the best. So we're going to always include the good. This is our basic physical medicine component, and then we're adding better and best, and we're picking and choose which one we want to use based on cost. So now we're going to move into the exam room, and I'm going to show you when it comes to your neck or your low back, how do we assess? How are we going to look at, is it a disc, is it biomechanical, or is it both? And we should be able to understand what it is based on our assessment. So when people have low back pain and they talk about stretching helps me greatly, what we're really talking about is stretching the piriformis, stretching the psoas, which is on the underneath side or the anterior portion of the spine, stretching the hamstrings or the hip flexors, or some combination of this. When the pelvis torques, say that her right side has torqued backwards, I know that this hamstring is going to be tighter on the right than the left. And conversely, the left hip flexor will be tighter on the left more than the right. So these are patterns that we see. Okay. My rehab protocols are based on Yanda, which is the upper and lower crossed. If we have a lower crossed disc, we're going to rehab that patient from the chest down. It's not just the low back, we're going to rehab them from the chest down. Conversely, when we talk about C-spine or neck, we're going to rehab them from the waist up. So therefore, the patient will be able to return to normal function and not have any limitations like we typically see. Again, thank you for tuning in. This is how we differentiate at Advocate Integrative Medicine between a disc, biomechanics, soft tissue, and then we piece the whole thing together because we aim to get you better, faster, and better than you've ever been before. Thank you once again for tuning in.